STD screening, people think about it all the time, but how do you accomplish it in the most streamlined way as a woman? Blood work, pelvic checks, urine. Hi, I'm your local OBGYN. I love women and let's talk about it. So a screening test is basically when you are checking to see if you have something where you have no symptoms. So what does this really mean and how can you accomplish it in the most effective way? Well, the blood work will check for generally HIV, hepatitis, and syphilis. Yes, there are more things that you can screen in blood in more sort of diagnostic ways, but those are the most common screeners that we recommend, and those are generally done again with blood work checking for antibodies. They all have what we call a reflex test, meaning the initial screen is not 100% diagnostic, so then additional checks need to be done on the blood to confirm the diagnosis. Then, when we're talking about screening other STDs, such as chlamydia, gonorrhea, and trichomonas, you cannot get that with a blood test. So you can do it with a pelvic swab, which is the most common, and it's pretty darn precise because it will actually get down to like what we call like a PCR genetic level. And then what we do is we make more of whatever's in that genetic soup, send it to a lab, see what we find, and then report back on it. You can also look for trichomonas under a microscope. There are some lab tests where you can get this done with urine as well, and this is often done when we're checking lots of people in a common area. Now, you can't get a one test fits all for all of these things. There are dozens, if not more, STDs that exist, and a lot of them you do have to have a sign or a symptom that we can get some more classic information, diagnoses, biopsies, things like that in order to give you information.